Hi guys. So let's start with the question of the day. A 40-year-old male is diagnosed with invasive aspergillosis for which he was started on voriconazole. He is also a chronic alcoholic who daily takes PPI, that is omeprazole, before breakfast for treatment of peptic ulcer as told by his doctor. Which of the following statements is false regarding the drugs used by him? A. Voriconazole acts by inhibiting cell wall synthesis via preventing conversion of lansoprazole to ergocetrol. B. Dose of omeprazole should be increased in this patient. C. Isavuconazole is also used as an alternative drug in treatment of invasive aspergillosis. D. Voriconazole is metabolized by CYP2C19 and CYP3A4. So now let's start with this question. Invasive aspergillosis. First of all, aspergillosis is a very important topic. One question will be asked from aspergillosis, mucormycosis. It will definitely be asked. So this is a photograph of aspergillosis. Now how do I know this? Aspergillosis. From A, you can learn that it has an acute branching. This has an acute branching. SP. From SP, you can learn that it has a septate hyphae. That septations are present in the hyphae. So this is aspergillosis. This photo is a PYQ. This image comes very often in your exam. Now he was started on voriconazole. So from this you know the drug of choice for invasive aspergillosis is voriconazole. I used to learn like A. If we inverse A, it will look like a V. So the treatment is voriconazole. Now he is a chronic alcoholic, so increased risk of peptic ulcer. So the patient is now taking PPIs. So by this, I would like to discuss about azoles. I have included almost all the azoles which I find are important. So in a fungal cell wall, you know that squalene is converted to squalene epoxide, then it is converted to lansoprazole, and then it is converted to ergocetrol. So why should you learn all these names? You should learn by SLE. So from S to L, what terbinafine is present? It is a sidal drug. It inhibits squalene epoxide. And from L to E, that is 14 alpha demethylase. This enzyme is inhibited by all the azoles. Now first let's start with cotrimoxazole. So cotrimazole, it is a drug of choice for vulvovaginal candidiasis. Very important point. Ketoconazole. So we have to learn that absorption of all the azoles are increased by gastric acidity. Oral absorption of ketoconazole, it is facilitated by gastric acidity. It is used for Cushing syndrome. Side effects include gynecomastia. The other drugs which can cause gynecomastia, you can learn it by a mnemonic, very famous mnemonic, DISCO. From D, digoxin, isoniazid, spironolactone. From K, ketoconazole, cimetidine. O, estrogen. These are the drugs which can cause gynecomastia. Third, fluconazole. First, fluconazole you can learn like it flows in the urine. So it has renal elimination. It is useful for vaginal candidiasis, oral candidiasis, cryptococcal meningitis. In vaginal candidiasis, yes, the drug of choice is cotrimoxazole, but fluconazole single dose can be given for vaginal candidiasis, that is 150 mg. This can also be asked. Now very important question, a PYQ. What is the treatment of choice for cryptococcal meningitis? So there is two phases, induction phase and maintenance phase. For induction phase, you have amphotericin B and plus flucytosine. And maintenance phase, first you have to start with IV fluconazole, then convert into oral fluconazole. Itraconazole. It is a drug of choice for dimorphic fungi, that is histoplasmosis, blastomycosis. And you can learn like this. This drug, it will break your heart. So it can cause impaired LV dysfunction, and it should not be used in patients who have congestive heart failure. Now what is this picture? This picture, it is showing broad based budding. So this is blastomycosis. Just wanted to include this picture also. Now coming to the drug voriconazole. I told you A, if you invert, it looks like V. So it is a drug of choice for aspergillosis. It is useful for fluconazole resistant candidiasis also. And high fat meal reduces its bioavailability. Now, this is a PYQ, which antifungal, if given with high fatty meal, increases its viability? That is griseofulvin. You can learn like grease has a lot of oil, a lot of fat. So high fatty meal, if given with griseofulvin, will increase its bioavailability. What are the side effects of voriconazole? Very important side effects. First, from V you can learn like visual toxicity. So visual side effects are present with voriconazole. Photosensitivity is also present. That is, it can cause skin cancers also. And QT prolongation can be also caused by voriconazole. Posaconazole, it is also used for mucormycosis. So these are some important azoles which I wanted to discuss, and expect one question from antifungals. This is a picture from first aid. You should know all the mechanism of action. Today we are only discussing about azoles. Now coming back to the question, voriconazole acts by inhibiting cell wall synthesis while preventing conversion of lanocetrol to ergocetrol. We write SLE. From H2L squalene epoxide, it is inhibited by terbinafine, which is a sidral drug. LE 14 alpha demethylase, it is inhibited by azole. So yes, this is a correct statement. Dose of omeprazole should be increased in this patient. No, dose should be decreased in this patient. Why? Because omeprazole being a PPI, it will reduce the acidity. So the acid content of the stomach will decrease, which will decrease the bioavailability. So the dose should be decreased, it should not be increased. Isavuconazole, it is a new drug which is now being used for treatment of invasive aspergillosis. And yes, you should learn this. Voriconazole, it is metabolized by CYP2C19 and CYP3A4. So this is all about azoles, and antifungals is a very important topic. You should all revise this. Thank you guys. See you tomorrow with another question.